forth there. So again today, folks, we want to welcome you here to our webinar. We are live today. We're going to be talking about real people with real success stories. I know many of you like to know about how other medical billing companies through American Business Systems licensees are working. Some of these people we actually have some videos of that we're going to share with you here in just a moment. But I also like to make sure that we're being heard, and we're going to try to test out a couple of things here just to make sure that everything's going smoothly. For those that can hear me, my name's Eric Ogea. I'm the Director of Research and Development here at American Business Systems. Again, Patrick's going to be able to share from his computer some videos of which he's taken between he and some of the other licensees here. But for those that have just first joined us, it's your first time to ever be on any of our webinars, we certainly want to address how to get to our web page here, which is absystems.com. Certainly you can find out more about us, find out about the business package, the income potential, the news, everything that's underneath the blog there, so you can certainly get into there. For those that are doing your research, we know that there's lots of places you can go on to the internet and be able to do that. But what you want to be able to do is go to a reputable place like the Better Business Bureau to find out the real stories about American Business Systems and how we interact with our business owners. If there's any problems, certainly they're going to be the first to address that. So certainly go to the Better Business Bureau and check us out there. We'd love for you to come by and visit us. For those that can get here to the Dallas-Fort Worth area, or if you'd like to fly into the Dallas-Fort Worth airport, we'll certainly make arrangements for you to get here to our office. It's at 5751 515. I can't remember it. I'll get it to you here in a second. It's on Kroger Drive, though. We'll certainly get you the directions how to get here. It's in Fort Worth. We're a suburb just north of Fort Worth in a community called Keller. We've been here for, my goodness, going on 15 years here as well. So we would like for you to come on by and join us and visit us here. If we've got some opportunity, we're actually going to show you a little bit about our platform as we go through here today. It's what's about iClaim and EMRX. We've got some screenshots of that, but really what you're going to be hearing from are from our licensees that are actually using this platform. I'll introduce you to Patrick Phillips. Certainly Patrick is well-rounded, got a lot of things going on in his life. Not only being the founder and the CEO of American Business Systems, he was formerly an Apple executive here in the Dallas-Fort Worth area. He certainly didn't move his family up to the Northwest. He stayed right here in Dallas, Texas, and became a best-selling author with a couple of his books here, Cash Crunch to Cash Flow, How to Reprogram Yourself. He's been a national recognized motivational speaker. He's actually on the editorial board of the Billing and Coding Advantage magazine, as you can see there. And he's the founder of an association that we have, which is called Medical Revenue Managers Association of America. So let me get Patrick on here. Here's a couple of his books on here. So Patrick, if you've got a way to pop your video on here, let's you and I go ahead and get started here this afternoon. Good to have you here, Patrick. Today, what we're going to be talking about are our licensees that are spread out from all over the country, from the West Coast to the East Coast. And Patrick, you've talked to just to every one of these, haven't you?
Yes, many, many more than that. In fact, I'm going to point out here a little bit later how people can go actually see the full interviews, which are, most of them about an hour long. We're just going to show clips of those today to kind of give you whet your appetite maybe for those. But folks, these are people who've gone through our training. They've done the due diligence that you are doing probably on us right now. And they have decided to go through the training, have started their own business, and you're going to hear their success stories, how they started their business, how they got their first client, how many clients they have. Good stuff today.
Absolutely. All right. So while Patrick's getting that first video started to get ready to get queued up here, we found this. Patrick, you just recently found this here, staff salary surveys of 2015. And you've got up here that 66% of practices said they don't have a plan to give raises this year or even moving forward. And it looks like there's one of the biggest reasons there smack dab right in the middle of us. Yeah,
the very thing that people who join us, we call them licensees, for those of you who are new to these webinars, but our licensees go out and help them to get those reimbursements from the insurance companies and from Medicare And that's the biggest problem as to why they're not getting raises. Decreasing reimbursements by the payers and the patients. Notice the patients even don't pay, Eric. I'm hard to believe that people don't pay their medical bills, but I remember a time when I would throw mine, well, I was trying to say in the trash, but to the bottom of the stack, you know?
Right. Who doesn't do that? And because we think, well, doctors are so rich, they're gonna make it anyway. But you know, being in the business as long as we've been in it so far, we notice, and we've known over at least the last 5 to 6, 7 years, that doctors have really struggled with reimbursements. Especially
about 57% of the doctors surveyed say that this is why they're not, giving raises to their people, because their reimbursements are decreasing. Eric, our licensees are solving that problem for doctors nationwide. Hundreds, thousands of doctors that are in our system, and we're solving that problem for them. So that's good news for the doctors.
Absolutely. And we're going to show one more little statistic here that, I mean, we've shown this one several times, but as you're getting into any business industry, you certainly want to know, is there a market out there for you? And this is from the Black Book rankings. People, you can see that, blackbookrankings.com. You can certainly go out there. This is what was conducted right at the first of the year this year that says that 42% of all physician practices that consist of 1 to 5 doctors. Now, see, that's the sweet spot there. That's, people are always asking, do I go after the big groups? Do I go after the 1 to 2 doctor groups? You can see this 1 to 5 doctors hope to outsource their billing within the next 12 months. Well, we're still within that 12 months. Do what?
Eric, that's almost half of all the doctors that are out there wanting to outsource their billing. Now, that's from the people who are not outsourcing their billing already. So it's a huge market.
It's a very huge market. Folks, one thing about the Zoom meeting that we want to remind you about is that there's a way that you can write in and type in your questions. And if you have any questions throughout the presentation today, even though it's a little bit different from what we've been used to on the GoToMeeting or the GoToWebinar platform, there is, right in your little control panel right up at the top, you should see that there. There's a place where you can type in your question. That way you can communicate back to us. We'll be able to see that, and hopefully we'll be able to answer that live while we're on the air today. Patrick, is there a video clip you got ready to go that you want to start off with?
We got one here. Let's hear from, this is a fellow named Bob Wilkie, and I'm going to play just a little clip. We're going to let you hear him directly from his own mouth say a few things. I'll be pausing, and Eric and I will be commenting on that just here in a second. So let's get that first one going here. First of all, when you first started looking at ABS, what were you doing at the time, Bob?
Well, my wife and I had just married. She'd moved from Scotland, and I don't want to just sit around now that I'm here in the United States, so I said, start a company. I'll support you.
Yeah.
So started researching a number of things, and before I knew it, she decided that she wanted to get into medical billing. And the reason she got excited about it is because she went online and found out about ABS. And she said, this is the group that I want to get training through. And I said, well, what's it take? She says, we've got to go to Dallas for a week. Well, I like Dallas. And I said, I'll go with you and support you. And after a week of training, I said, boy, this is a way for me to get off the road. And so we started the company in December of 2007.
Now, Eric, I just want to point out something. That what he just said was that his wife was looking to start her own business. And he had no clue as to what it was all about, but he said, hey, I like Dallas. I'll just go with you to the training. So he was here with her during that week of training, and while he's here, his eyes were open. We've seen that many times, haven't we?
We certainly have. We've had, and it's just been the opposite too. We've had the husband come and have bring the wife, and then so it's both parties, and sometimes it's even partners that we've been able to see that too as well. So that's awesome to hear from someone like Bob here.
Yeah, it is. Let's hear it.
Well, my background was in the sports collectibles world for about almost 25 years. I had retail stores at one time. I worked for a trading card manufacturer as a vice president of sales and marketing. I was on the road a lot. I was traveling 100,000 miles a year, and with my new wife, I didn't want to travel as much, and I saw ABS, or medical billing, as a means to get off the road, start our own company, and which is what we did.
Well, you know, that's pretty inspirational because you obviously, neither one of you had any background in the medical field.
No, not the closest we came is going to the doctor for a flu shot. And for us, either one of us to decide we wanted to get into medical billing was, we both thought, are we crazy? Because that's certainly not our background. We knew nothing about it. And we're still learning. As you know, it's an ever-changing, evolving industry.
Hey, another good point, Eric. Sorry, I turned off my video. Let me turn it back on. Here's Bob saying what we hear many, many times from people that have no background. Remember, him and his wife had no connection to the medical field whatsoever.
Right.
And yet once they come down here, their eyes are opened as to how great an opportunity, how great a business this is to be in. And so they both wanted to jump into it full time when they got back to the office.
Well, Patrick, before you started up, I've got a couple of questions that have come in, and Jorge's asking about his main question is if about helping getting a client within, like, the first 30, 60 days. I'm sure Bob's talking about this because we're going to get into that. So I kind of want to help with this question. And Jorge's asking, could ABS have someone help him intervene to help get that business for him? Let me answer that for you, Jorge. One of the things that we do, and you're probably going to hear this, maybe not from Bob, but from one of our other licensees that we're going to hear from, is one of the ways that we help guide you and help your company is when we do these demos live for you. That is so huge of helping you get that piece of business, sometimes within 30, sometimes within 60, sometimes within 90 days. It just depends upon, you got to remember, this is a relationship business between you and the doctor. And Patrick, you've said this in the past that, people are ready to buy when they're ready to buy, not when we're ready to sell them anything. And so this is just a relationship business here that we're involved with, Jorge. And it just depends. Sometimes you're able truly be able to get that doctor pretty quickly, but it's really how we help intervene through that demonstration.
Yeah, and the hard part about doing these webinars live, folks, is because we really could have a 10-hour webinar where we covered every topic. And one of them, of course, that's of importance and that's really of a concern of a lot of people starting any business is, how do I get clients? One of the things that we're good at after 21 years is knowing how to help people go out and get clients.
Right.
It doesn't mean that we're going to go out there for you, because if that were the case, we could just go sign up all the doctors in the United States ourselves. We don't want to do that. What we've done for 21 years is teach you how to go out and do it. And
right.
It's like giving a fish to somebody or teaching them how to fish, you've heard that. We want to teach you how to fish, and we're going to show you how to build not just this business, but any business, because our marketing ideas and techniques work for any business.
Right. And to kind of follow up one more thing here that Jorge's asking here is about a list of medical providers. Now, what we do have on our website, we have a search area on our website that will kind of help provide that type of listing of medical providers in your area. We've actually tried it sometimes to help provide a list, but by the time we get you or any of the other licensees the list, that list becomes old within hours. Yeah. So we've got a different way to be able to do that. So yes, we do have a way to help you find medical providers, help you find people in your area that are actually looking for medical billing.
And Jorge, there's specific webinars out on our blog. If you go to our website, absystems.com, and then under the news tab at the top, there's a blog. Well, on that blog, we have all kinds of webinars that we've done, like this one, but specifically on how ABS helps you to get clients. So I encourage you to go out there and browse through those older posts. When I say older, they're all once a week for the last 5 years. Go through those and find some that are on that topic. All right, I'll start the video back up here.
Great.
Oh, all right, so you got back, you got into the business there, you went through the week-long training. Can you give us some feedback, first of all, about the training itself and maybe even the support that you found from us afterwards?
Well, I'll mention the support first because it's never stopped. Whenever you need help, you just contact us. And that's been true every single time. You've always been responsive when I've sent you an email. I have said your staff, and you've provided us with other opportunities, not just in medical billing. We built a nice residual base because of that, so thank you, Patrick. It's a real good, solid base. So we got involved in credit card processing to get into the doctor, get their credit card business, and gain their trust. And that has worked. but it kind of grew a life of its own. And so now we represent manufacturers, distributors, restaurant owners, doctors, dentists, orthodontists, and so forth and so on. So you've helped us, ABS has helped us build a whole new business.
Now, Eric, we got to pause there, right? Because what he's done is he's brought up one of our auxiliary services that we don't normally even talk about on our webinars. And that's providing credit card services, merchant services to the doctors. That is another one of our, it's in our physician's toolbox, we call it. And it's another service that some licensees have taken and just run with that because it's, like he said, a great door opener to get in to talk to the doctors.
Absolutely, and I'm glad you brought up the physician's toolbox, because I want to answer Jennifer's question now. And she's asking, aren't medical billing coders supposed to be certified, and do you provide information for licensees to get certified? Well, let's answer that real quickly, Jennifer, because there's a difference between a medical biller and a medical coder. Now, inside of our physician's toolbox, we actually have one of the services that we are actually a service for coding. So it takes away from you having to become a certified coder. We already have certified coders. So if a doctor asks you, Jennifer, if you need, or if the doctor needs coding, and he's asking or she's asking, can you do some coding for me? You can absolutely say, yes, I've got coders on my team. I've got that capability of doing that. So that way, then you're able to provide that particular service. Now, the only thing that you need for as being a medical biller is to go through either a school, technical school, or some type of degree program, or go down the route of American Business Systems. We'll teach you everything you need to know how to do as being a biller and not necessarily a coder. There's two separate things. We've actually done some webinars on that too, where we've talked about the difference between a medical coder and a medical biller, and certainly you can go back and look at those. So Jennifer, just let us know if that helped answer your question.
Yeah, and Eric, since you mentioned earlier that I'm the founder of the Medical Revenue Managers Association of America, I thought I would just show this. It's actually hanging right here on my wall, and this is the certificate that we give to people at the end of the live training workshop. So as you can see, folks, we are going to certify you as a medical revenue manager. That's important to know, because certification is just from any organization that has the ability to train and teach somebody how to do the medical billing. We do that for you during this week of training down here.
We certainly do. All right, let's keep going with Bob's video there, if you got it.
All right, here we go.
It's exciting when it just shows up in your checking account every month when you expect it to.
What did you do at first to try to find doctors?
We put on some free educational seminars. We had assisted living places host them for us. They provide the refreshment because they want exposure for their facility.
Sure.
But what really worked was networking. And I thought I knew how to network.
It works.
Yeah. So all but one, we have 7 medical billing clients of various shapes and sizes. All but one of them came as a result of BNI.
And how did you get that one, the one that didn't?
Through the free medical, the free seminar that we put on, the educational seminar, which is recommended as well. Those were fun. The people that were there, you knew they were there because they were interested and they were potential clients. It's being out there, and I found that going to as many networking events as you can is really crucial, because something's gonna click and they're gonna recommend somebody that needs their help. And I think one thing that's important to the mental health clinic that we recently signed a few months ago, they've already referred us to another mental health physician for medical billing as well. So it does snowball.
So let's see.
So 2 things there that we need to talk about, Eric. One was he mentioned BNI, which of course is Business Networking International. That's an organization that we teach our licensees to go out and become a part of. And go to their meetings, because that's where you can meet other business people in your community and make some great connections. So any kind of organization that meets like that, the Chamber of Commerce is one of them, of course, those are good to be a part of. And the other thing you mentioned was the educational seminars, which we teach our licensees to do. In fact, we provide them the educational materials to do those seminars, slideshows and so forth, to teach and educate the doctors and the office managers.
Exactly. I've got a couple of new questions that have come in here, and Nikhil is asking Bob. Now, Nikhil, what we're doing, we're watching a video of Bob, but he did say you were asking how many practices does he have right now, and how many employees does he have to manage the company. He actually has 7 practices currently, at least from this video. I think he's actually got some more, and I think he's got actually some employees, so I'm not sure how many employees that he actually has, but that's a great question. But he has managed to grow his business up to at least 7 physicians at the time of this particular video.
Yeah, well, I think it's 7 practices, but there may be several physicians in each practice. But the point is, I think he says later in this that he has hired 3 people too.
Good.
But again, these are just clips of interviews that are done out there, and I'll show you here how to go see those here in just a second. Let's hear a little bit more from Bob.
Sure.
What was your first type of doctor client?
One of the new members had a relationship with a massage therapist. I don't know too many wealthy single massage therapists, but this particular one hated doing her billing. And we had not done any billing at this point, and so we thought this would be a great practice for us to at least get our foot in the water. And this was probably about a year after we'd gone through training. So we made a presentation. She gave us the business. She's still our client, and we've done a number of different things with her. It was probably the least difficult client to secure. But again, somebody recommended us to her because she liked the person and trusted the person that recommended us. So that made all the difference in the world.
Okay, so I got to pause there because he's talking about he got a reference from somebody who was also a member of BNI. In other words, again, back to the networking, somebody referred this client to him. And what he just said was the key, that once you've gotten a referral from somebody who knows somebody, they already know and trust that person. So it's an easy, you just call them up on the phone and say, hey, I was told that you needed some help and I can help you. And they'll tell you to come on out and, sign them up.
Yeah, and that's what the beautiful part about this is, and that's one of the areas that we really work hard fine-tuning during our training class, because as though we think we know how to maybe market any business or service, it's a little different whenever it really comes down to physicians. And I know that you've interviewed Dr. Vicki Rackner. That'd be a great video that maybe we could pull up a little bit later. I don't know if you can get that clip today or not. But, she says, being a doctor, she likes to hear from other doctors, or at least people that have been referred to her by other doctors. And so what Bob's talking about here, about this whole networking thing, that's where it's huge, and really getting in front of that doctor, besides some of the other techniques that we certainly have to help you get in front of the doctors as well.
Absolutely. Okay. Oh, I just clicked on the wrong button here. Let me see. Share the screen. Here we go. All right, let's do some more from Bob.
Got a group of chiropractors who had not been paid by Medicare in 3 years. And so we helped solve that problem for them. And to this day, we're still doing all their Medicare billing. But it was, again, a nice practice because Medicare is one of the more difficult insurance companies, if you will, to get paid. So that was good practice for us. And again, they're still our clients today. Yeah, in fact, it was supposed to be a temporary gig, and we're going to do it for them for 6 months, recover all their past due, go back as far as we couldn't get them paid, and then teach the in-house biller how to do Medicare. So we did, and 2 weeks later she called us back and said, will you just keep doing Medicare, please? So it paid off for us. For those of us that have smaller clients, I think that's usually the reason they go with us, is because they don't want to mess with the hassle of the red tape. They want some extra time for their family or their practice. An acupuncturist that was a member of he had just joined our BNI. We've been doing his billing ever since. It's been fun to watch him grow from nothing into a nice medium-sized acupuncture practice. Sonia, then we had, in fact, we've actually picked up 3 clients in the last 4 months. One was a very small massage therapist. And then, as I mentioned, the mental health clinic and the naturopath. And the naturopath also has, she's licensed massage therapist, a licensed psychotherapist, and a licensed acupuncturist. But what we're finding is a lot of these practices are 1 or 2 years behind in their billing or in their postings or in a myriad of things. So we're there to not just do their billing, but to help sort things out. And obviously the older the claim, or the older the patient balance, the higher percentage we charge, because obviously it takes more work and effort to resolve those issues and hopefully get them paid. And when they get paid, we get paid.
Hey, I've got to just mention here that you notice he's talking about massage therapists and acupuncturists and so forth. Eric, I think that brings up the good point that a lot of people think of this as just their own, general practitioner doctor that they go to, when really there's dozens of specialties out there that need help with their billing. I mean, literally, probably over 100 specialties in the medical field. So you never know where your next client is going to come from, because an acupuncturist might know a chiropractor who knows a math specialist who knows, it just goes on and on. The referrals is how you build your business, and that's what he's talking about here.
Let me, while we got a little break here, let me answer some of these questions. I love the questions that are coming in. Again, I'm going to address, Jennifer, you're asking a question again about the coding. The system actually does the coding for you, as you could actually get with your ABS coach that you're working with. They'll be happy to do. I got to figure out a way to turn off my phone here. I got a new phone, and it is, I keep pressing silence, and it'll keep ringing on us. But yes, you can be able to see our demonstration of our system, and you can see as you're going through this presentation how it does code for you for the doctor. So yeah, again, thank you for your question there. And then Jorge is asking another question about how to get in front of doctors too, and he's asking a question about the gifts. I think the pharmaceutical reps used to give gifts to the doctors, but that has actually been stopped. But that doesn't do anything to you as a medical revenue cycle manager. You can do whatever you want to be able to do, and provide lunches or breakfast or anything that you want to do to try to get their business. And the second part of his question is that he's want to open up for this both for he and his wife, and then he's asking, does she have to pay the fee as well? No, there's only one fee for you as a business, as a family. So certainly you can even have her attend the class with you. There is a $9.95 additional seat charge, right at $1,000. That would be the only extra cost there. I'll get to some of these other questions here, Patrick. I know you want to kind of wrap up here with your interview with Bob, and I know you've got some others there. So let's get right back to some of these videos.
Okay, we're just about finished with Bob here. Let me show you.
And it's quite simple, as you're probably aware. I mean, I wish our first client could have been a cardiologist, but we can't have everything. But
right.
It's fun to grow your business, and it's fun to get some more diversity as we are now. We've moved away from just massage therapy and chiropractics into some psychotherapy, and of course we now have psychiatrists, psychologists, and counselors that we're doing their billing for. So that's interesting.
Bob, are you basically full-time right now?
Full-time. In fact, we're putting in more hours now than we have in the past. I didn't go into this full-time in 2007. I still was doing my gig with the National Sports Collectors Convention through 2010.
Oh.
It was in late 2010 where we really began working our business in earnest. And that's when we started to see more growth. And then obviously this year it's just really taken off. The health clinic, they have 6 providers, and they're adding 3 more this month. So there'll be 9, which means more workload for us, but the opportunity to make additional money. We've also had to hire more help because obviously there's a lot more involved here. So we have 3 people working for us doing data entry, whether it's posting of payments and applying them, calling up insurance companies on unpaid claims or at least unresolved claims. And then another one that's working on patient past due balances. So one of our clients has not sent out a statement to their patients in over a year. So you can
Did you hear that, Eric?
I did.
One of their clients, they have not sent out statements to their patients in over a year. There's a whole bunch of money, and then their patient receivables, aren't there?
There certainly is, and like you said, although he would love to have landed a cardiologist or some other type of bigger doctor that you might think of. I mean, a lot of this is coming from, I bet you, a lot of areas that people didn't even think that they could go in after. Massage therapists or acupuncturists or whoever might be out there. These are people that are providing medical type of services, and they too need to to get those bills out. If they're billing Medicare or they've got receivables out past due, that they need help getting that collected. So there's a lot of things that you can do here. I'm glad you brought that clip up here from Bob.
Yeah, and a lot of people wonder, well, why wouldn't doctors just do their own billing? Well, some of them do. What they don't realize is that they could do it a lot cheaper by outsourcing it, because you're only going to charge them, somewhere around 6 to 8% probably of the money that you collect for them. That's a very small amount, folks. They spend twice that on having their own staff, keeping them trained and up to date. You got turnover inside the office, all kinds of overhead there that it's very expensive to do that themselves. And besides, that's not their core competency. They should be seeing patients. That's where they make their money.
Exactly. All right, let's answer a couple of more. You have any more, Bob, that you want to play there, and then we maybe can take some questions here?
I got another lady here that we could hear from. So
Kelly's asking the question, is this being recorded? This is being recorded, and you can present this to your wife in a recorded version. So we should be able to get this up here pretty quickly, and we'll be able to take care of that very well. Patrick, let's hear from this next licensee, because there's some good things that she says here as well.
Yeah, this was a good interview with Janet Calkins. Tell me about your business. I want to see where you're at.
Oh, well, we had a demo recently with an orthopedic group. It's got about 12 providers in it. And then I came home that same day, and the webinar on the new iClaim was on. And I was so excited because I was like, okay, that checks off everything that they wanted. So I'm just waiting for them to get back to me on time. So hopefully, I have my fingers crossed.
Yeah, well, that'd be a great account to have, wouldn't it?
So they have a clinic, right? They have a clinic, a surgery center, an outpatient surgery center, and a PT. Don joined me in the business about a year ago.
That's your husband.
And so, he's been kind of working that marketing end. I've been doing more of the operations. And so, we just hired a sales rep to help us.
Well, good for you.
Okay, so she just said that her husband had joined her in the business. They're both full-time in this. That's because they did sign up that client that she just talked about there, because this was done over a year ago when I interviewed Janet. But they've also had to hire more people. They're thinking about opening up their own office. And, it's just gone from part-time to full-time pretty quick for them.
Yeah, and boy, that's what it happens. Is sometimes I think, especially with a new licensee getting their first client, they're just excited about getting that first client, but then they realize that now they're really into the work part of it, and then how quickly other business comes right after that, right on the heels of them getting started.
Yeah, in fact, Eric, as you know, we have many licensees who tell us that even though we teach about a dozen different ways to go out and get clients, all it takes is one. Because if you do a good job for that one, that doctor and that office manager knows other office managers and doctors. And so your business grows from referrals. I've had licensees tell us that that's all they've done is to go out and do one of the ways that we teach them to get clients. And got that first one, and then it just grew from there, and they've never had to do any more marketing since then.
Yeah, and that kind of answers Shane's question here, because it says, he goes and says, I understand that there's easier points of entry to get to some of these other smaller maybe practices, but I'm not hearing about general practitioners and specialists. Well, here you're hearing from her, she's dealing with a specialist here. So absolutely, you can get into urology, cardiology, podiatric, pediatrics, and any type of specialties that are out there.
Yeah, absolutely. All right, let's hear some more.
We have 3 accounts.
Oops, I think I paused that and didn't mean to, or something there.
And I've been doing more of the operations. And so, we just hired a sales rep to help us.
Well, good for you.
We have 3 accounts that originally signed with us when we first got started. And then a friend of mine that also left the same company that I was working for, she works for us now. So we added 4 more accounts with her.
So you have a total of 7 accounts then.
Oh yes, Don and I both are, and we hope to be adding a lot more accounts this year.
So Janet, are you working out of your home right now?
Yes.
Yeah. Okay. Well, you could get to the point this coming year where you need a little more space. Who knows?
Yeah, that is our goal. Yes. We've been looking at places in town, so we're excited to grow.
Now, Eric, that's a good point, too, because a lot of people don't realize that this is an ideal business to run out of your home. The doctors don't come to see you there at your home, and yet we have licensees who have opened up offices all over the country. In fact, some of them on our reference list, if you ask them nice enough and tell them you'll take them to lunch, they'll probably let you come visit them at their office and make arrangements to do that so you can actually see a full-blown operation. But a lot of them still work out of their homes because until you get to a certain point, you can manage that with a handful of doctors yourself. At some point, you probably think in terms of, well, maybe I need to find an office where I can hire somebody and just kind of run this as a real business.
Right, and that's what's been so great about this business, because I think most people they want to start small, they want to start in their home, and they want to be able to work from their home. And there's always been this kind of a little cliche thing about, oh, you got to work from home, or do the doctors, are they going to worry about whether I'm working out of my home? Folks, this is a business, so I'm going to answer 2 questions here as we're kind of looking at that. And Jorge's asking the question. Can I have providers in multiple states? Absolutely. You can be in your home in Texas and have a doctor in New Jersey. And then if you're working from home, do you think your doctor in New Jersey even cares about whether you're working from home or in an office? They don't care. They don't see you as much as if you were right there in town. And then for those that do work in town with your doctors, folks, the doctors just don't have time to come by and visit with their biller in their office. So there's really no worries about whether you're working from home or whether you're working from a brick and mortar building that's outside your home. Certainly, as you grow, you might find it a necessity then at that point to have an office outside of your home.
Yeah, because a lot of doctors, if you think about it, you can give them access to the system that you're doing the billing in. It's a cloud-based system, right? So they can log on from any computer anywhere that has an internet connection and actually see the real-time status of their claims and their money. And so there's no really need to even send people reports anymore nowadays with our kind of system that's cloud-based. All right, how about a little clip here from another fellow named Benny Biordi. Ring any bells, Eric?
Yes, absolutely.
I don't know. Let me see if this enlarges. Oh, yeah, it does. Okay, here goes.
Prior to signing up, becoming an ABS licensee, we had a cleaning service business, and needless to say that was not something which was, number one, profitable, number two, something we were comfortable doing. Trisha, who happens to be my wife, decided that there had to be something better out there, and once we found ABS business systems, we knew that was something we wanted to look into. We did not have any medical billing experience prior to it, so this was something that was totally new for us, and quite frankly, we're very happy that we did make that choice. After leaving Texas, we flew back to New York, and we were really excited about getting this business up and running. We aggressively started marketing. Probably the next day the plane landed, and it took us 3 full months to get our first account. Once we did get that account, obviously getting our feet wet did give us the opportunity to understand the business a little bit more. I'd say we got the second account probably 4 months after that. So within 7 months, we got 2 accounts, but more importantly, it took us 8 full months to have our initial investment paid for. We were able to get our...
Okay, now, Eric, that's an important point that some people might have let slip by. He said that he got a return on their investment in this business. In other words, the licensing fee was $5,000 now. It was probably a little less than that back then, maybe $20,000. But the point is, he got that back within 8 months.
Right.
That's unheard of in any business for you to get your entire initial upfront investment back within the first 2 years is an amazing thing. So
well, I know that the statistic on new business and small business is even if you're still around in 2 years, you've done well. Whether you've made a profit or not is beside the point. Just as long as you're around it for 2 years, I mean, you're actually considered a real business at that point. But then being in business and then getting that return on your investment within 8 months is pretty incredible. So it is something to very much behold. But again, these are success stories. We don't certainly say that everybody gets that. Everybody works a little differently. Benny has owned a business before, so he had good business acumen already, Patrick, and that's what it takes to do really well in this business. Just thinking of how to really work business. Be business conscious.
Yeah, but he doesn't say that in this clip that I got here, but during that interview, and that was, by the way, I traveled to New York to actually capture this video and visit with him and his wife. My wife went with me, and it was a great time together. But he says, Patrick, I never made any money in my previous business. I never made a profit. So for him to go from that to this business, he was just pretty amazed that he could, make back his entire investment in such a short period of time.
Absolutely. Yeah, let's keep going.
First client by utilizing a sales rep. But I wouldn't just solely focus on one particular way of getting your accounts. In my particular situation, a sales rep who happened to be a pharmaceutical rep was able to sort of get through the gatekeeper and given the opportunity to explain to them some of our services. But I encourage anyone who's just starting, because every territory might be unique, you want to utilize every opportunity you have to utilize all of ABS's advertising techniques. You just don't know what's going to work. And I think the idea is to come at it from all different angles and find out what works for you, what's your niche in your market, and take it from there. One of the advantages of joining ABS is having the ability to go down and to spend 4 or 5 days in their seminar in Texas. Anyone who's interested in becoming an ABS licensee, I highly recommend doing that. You will find when you're down there, you'll find that you have anywhere from 10, 15 ways of learning advertisement in your specific field. Take everything that you learn from there, bring it home, try it, and you'll see what works for you in your particular area.
Yeah, so there's a good example of somebody who took one of our marketing methods that we teach is to find sales reps. Maybe you don't have the time or the inclination to go out and market. We'll show you how to find and hire and train and motivate and pay commissioned sales reps. They bring you an account and you pay them a commission on that. It's nothing out of your pocket.
That's right. Yeah, and that's one of the things that we do teach in the training class is how to utilize sales reps. And then from there, you can get that first one, and that second one comes by the reference from the other doctor. And then you don't have to rely so much on a sales rep. But if that's what it takes you to help get your first client, then we certainly talk about that. And a lot of our licensees get their first clients by doing that.
Sure. Eric, you just jump in with any questions now. I'm just going to continue playing clips until you interrupt me.
Yeah, go right ahead.
I had to do it all over again. If there's one thing I had to change, and that would be not doing this a lot sooner. Like I said before, I've gotten involved in different businesses. Not everything's worked, and I understand that. But I was fortunate enough to learn from my mistakes and try to find the perfect business model. And that happened to me 3.5 years ago when I became an ABS licensee. We currently have 8 accounts that we're servicing. Some accounts are bigger than others. Some accounts have more than one doctor in them. But nevertheless, we are servicing 8 accounts. We have 5 full-time employees, 2 part-time employees, as well as me and my wife. There's to add 2 more physicians on. That's been our goal every year, to add 2 additional physicians. We understand it doesn't matter. They don't have to be big account. We just have to continue to grow. Our goal is to maximize all our office space in this building and we have 3 more seats available. Without the support from ABS, we wouldn't be here. Like I said before, we had absolutely no prior experience in billing, in understanding medical billing. So it was very, very important that we had someone assist us, at least for the first 2-3 accounts, to get us up on our feet. My life, boy, in the last 3.5 years, my life has changed. You know, looking back now, I felt like it wasn't that I didn't have the energy or desire. I just felt like I wasn't in the right direction, or I wasn't motivated and focused in on a particular direction. Once we came across the ABS and once we discovered medical billing was going to be what we were going to do going for the future, I was able to take all my energy and direct it into this direction. You know, 3.5 years ago, we were all over the place, not understanding, not knowing which direction we wanted to go. And this was quite a blessing for us, for me, my wife, and obviously our 4 children. I encourage anyone who has an interest in potentially being a licensee of ABS to do their diligence, do their due diligence. We understand times are a little bit difficult now. No one can afford to make a mistake, but at some point you got to realize, can you afford not to do something like this? Like I said, looking back now, I realized that I was at the same situation where you guys are right now, and I was skeptic, I was unsure. I think that's probably one of the reasons that we're being videotaped here today, to realize that it can happen. If it happened to me, it can sure as well happen to anyone else. People always ask me, is this something, if I had to do it all over again, would I do it? And the answer to that is 100% yes. Because after all, how many businesses can you actually say after 8 months that you're able to recoup your initial investment? I'm not the type of person that everything I touch happens to work. The other business we had, boy, was 4 years, and after 4 years, we still weren't able to recoup that investment. To answer that question, I would say 100% yes.
Well, anyway, these are just shots of him and his staff members. You can see that's his wife, Trish, who was not there during the office during the day. She has 4 children at home, so she works kind of from there as well. And then this is shots of his actual people working there in his office. You'll notice that he's got several people. They all have 2 monitors, and that's because they have what the doctor sends them on one monitor, and then our system, our cloud-based system, on another monitor that they're working from there. So pretty cool stuff, huh?
Absolutely. And as we're kind of wrapping up with this, Patrick, this has been a great platform for us to do today. And I'm looking at the clock, and man, we're about within 10 minutes of wrapping up here. So I tell you, let's just take some more questions here. We'll kind of go through some of these questions. I don't know if you got one last one you want to share with us.
While you're doing that, I'll just briefly show our website, which everybody should know about anyway, but it's absystems.com. You can see it up there at the top of my browser. And this is where you go to actually see these interviews. Under news, there's a little link there called blog. And when you go there, you'll see not just the recent webinars that we've done, but all the interviews are there too. Just keep scrolling down and you'll see a lot of them there that, of course, we didn't get to today. There's literally dozens of interviews that we've done over the past, 3 or 4 years that we've done the blog. And so you can just keep scrolling forever there. And when you get to down the bottom, you'll click on older articles and keep going back in time.
Yep, exactly. So let's go ahead and jump right on in here, and I'm going to just start back at the top, and then we'll just get through as many of these as we can. Now, some of these questions, we will certainly refer you back to talking with your ABS rep that you're working with. And so if we don't get to all of the questions today, they are being logged. We'll get that to your ABS rep that you're working with, and they'll be able to answer that question to you as well. We're going to just go to the top. Looks like, Shane, you've got a couple of questions here that we'll see if we can answer right off of the top. You're asking if we can speak to the percentage of GPs outsourced to someone like ABS currently. I would say that GP is general practitioners. We don't have a percentage of general practitioners versus specialists or anything else. Like, they're really across the board. You also have to remember that we're set up as a a business opportunity and not a franchise. So that helps save you tons of money from having franchise fees and royalty fees. But with that is also we're unable to be able to check out the what other companies are actually doing there. And then, Shane, you're asking the question about the ACA. Has that affected our business here as well? It really hasn't affected our business at all. Actually, if it's done anything, it's actually helped help our licensees get bigger, get better, in the marketplace out there, just simply because of the challenges that the doctors are facing. So that has actually been a huge help there.
Yeah, we saw our signups actually increase, Eric, around the time that the ACA, also known as Obamacare, that came into effect several years ago. And once it did, doctors really got panicky because now they knew that they're going to see, 10 million more patients, that are now in the system that weren't in the system. And that doesn't count the baby boomers that are retiring. 10,000 of those a day retire and start using their Medicare to go see the doctor as well.
Exactly. Jorge's asked the question about this, Patrick, and maybe you want to answer this one. And this one has to do with more of like medical equipment, like durable medical equipment. He's asking, can we do billing for equipment companies like respiratory machines, medical beds, etc.?
Absolutely. In fact, my wife, Linda, started doing the billing for a durable medical equipment company back in 1987. And we have several licensees that kind of specialize in that. As you know, Janet Malinowski is one of them. That's all she does is bill for durable medical equipment. That's wheelchairs, hospital beds, oxygen, orthopedic shoes, and those kinds of medical devices.
Exactly. Jennifer, you asked about, can you speak to other ABS licensees? Absolutely. She says, hey, can you have Jason contact me? Jason, I know that you're on here, so get back with Jennifer. She's wanting to get some of that information there. Dwayne's asking a question about clarification question off subject on the seminar, but does ABS have its own clearinghouse or does it outsource? Actually, the clearinghouse is actually embedded into iClaim already. So it's not outsourced. It's not a third-party clearinghouse. It's one that's actually embedded in there. So hopefully that helped answer that.
That saves you money as a licensee because we own our own clearinghouse. You don't have to pay for every claim that goes through. That's all inclusive in the use of our system. And so it's unlimited number of claims. There's no charge for that.
Right. Jorge's asking, Jorge, you say this is last but not least question. I think it's so funny. Can I possibly get connected to managers that live near me before I sign on so I can see how they feel and ask them some questions in person? Patrick, you want to talk a little bit about pre-marketing? I know that's always been a question for folks about how they kind of go test the market before they actually get involved with American business systems.
Well, yes, but I also want to touch on one of the things that he's implying there, and that is that he needs to talk to somebody that's actually in his area. Now, folks, I know you find this hard to believe, but doctors are doctors, patients are patients, insurance companies are insurance companies. It doesn't matter. We have licensees from coast to coast, and yes, there may be some that are geographically close to where you're at. But folks, that doesn't matter because you don't have a territory. I mean, we've got a licensee we can let you talk to in Florida that has clients all over the United States because he's found sales reps in different cities. So you don't have to talk to somebody that's within your driving distance or something like that. Besides, some of them might be a little hesitant because they think of you as their competition. But the point is, there are so many doctors in any given area, folks, that you could never, ever, ever run out of doctors to talk to about this. Some of them are now outsourcing, and they wish they had a different company. Some of them are doing the billing in-house, and they wish they could outsource. Some of them are outsourcing now, and so the point is that there's always going to be doctors who need help. I put it this way, Eric, no matter what happens to the healthcare system in the United States, there will always be a need for somebody has to bill somebody for the doctors to get paid. And that's why this is a great business.
And again, hopefully, Jorge, we've answered your question here. I know that Patrick's answered it in such a way that about licensees that might be in your area. I think, Patrick, his question was kind of dealing towards, could he go speak to maybe some office managers in his area before he becomes a licensee, just to see
Oh, I'm sorry. I thought he used the term manager in relationship to our licensees.
Right.
Managers, meaning the office managers themselves. Well, that's a whole other story, because what if you get out there and you start asking them about different things and they ask you questions that you don't know the answers to? It's almost like going out and trying to market a new product or service and you know nothing about it.
Right.
That's why we encourage people to restrain yourself. Your very best prospects might be those managers that you're thinking about going and talking to, and you can get stuck on a question and you don't have the answer to it. It's better to go through our training. Look, with our live training and our money-back guarantee, you can't lose. You can come through and learn all that we teach in that week of training. And if for some reason you still don't think this is the right business for you, you can ask for all your money back. We don't keep a dime of your licensing fee. So it's better just to wait, see what we teach you during that week, and then it'll make a lot more sense. We had somebody in the last training class, Eric, that did that very thing. They had pre-marketed, and boy, he regretted it. He said halfway through the class, he said, boy, I wish I hadn't talked to the doctor because I look kind of like a fool. And I told him, well, I'm going to go and get some training, and I'll be back, and I'll answer your questions. But, you know, it's just not the way to market things.
Right. All right, we're up at the top of the hour. We're going to answer one more question here, and then we are going to save the rest of the questions to be answered by your rep that you've been working with. So, Sophie, you've asked the question, will there be any extra monthly or annual service fees for ongoing support? Patrick, you want to talk about that?
Was that last week that we did the webinar on that, Eric, where we actually showed that included in our fee is lifetime support? And there are no ongoing fees, upgrade fees to the software, user fees for people using the system. There's no ongoing training fees or webinar fees or demo fees. Folks, that one licensing fee that we came up with, I said at one point to our company, we want to have an all-inclusive lifetime fee. And that covers everything. So no, the answer is you'll never pay another dime to American Business Systems for anything. I guess Eric wants me to talk about this guarantee again. I talked about it earlier, and so there it is. Read it, and you'll see that if for any reason you don't think the business is right for you, simply tell any staff member they'll arrange for you to receive a full refund of your license fee. It doesn't get any better than that.
It doesn't. Patrick, thanks so much for helping putting all the video parts of it together today.
I thought it was great, Eric. I love doing these kinds of webinars, and hey, let's just continue telling people and educating people as much as we can about this great business.
Absolutely. Thanks, everybody. Y'all have a great afternoon.